Oh, sweet. Okay. We good to go, you think? Everything else good to go, Mandy? Okay. Okay, perfect. Great. All right. Welcome, everybody. We're going to call this meeting of the Assembly Health Policy Committee to order. It's February 7th, 2024, 9:15 a.m. We are here in conference room 155, and we'll go ahead and do assembly member introductions first. I'm Daniel Voland.
Karen Bronga.
And I believe on the phone we have Scott Myers. Scott, are you there?
Yes, I'm here, Mr. Daniel. Thanks.
Wonderful. And then Felix Rivera. Felix, are you there?
Yes, I'm here.
Fantastic. Any other assembly members on the phone with us? All right, I'm not hearing anyone. We will move then along the table here, and members of the administration can introduce themselves as well.
Kimberly Rash, Anchorage Health Department, Acting Director.
Tamaya Liebersbach, Anchorage Health Department Administration Manager.
Rochelle Alger, Purchasing Director.
Fantastic. Thank you all for being here. Okay, we do not have any unfinished business on our agenda, so we're going to move right into new business, and we will start, as we usually do, with our standing report from Ms. Rash, our Anchorage Health Department update. Go ahead, Kim. Oh, and I'll note for the record, just before you begin, it's about 9:17. We are joined by Member Brawley. Go ahead, Kim.
Great, thank you so much. So today's report is based on December program activities. So we have been working with Managing Meat Enterprises and the UAA Resiliency Lab. That is Annie Thomas Landrum. She was here at the last health policy meeting. We kicked off a new quarterly HD wellness session in December, which is a program to promote employee wellness and connection. About 45 employees attended the first session, and the session focused on encouraging employees to recognize what is bringing them joy currently, envision what they would like to see in 2024, and what they would like to leave behind in 2023. We continue to use our social media for alert the public on the holiday closures, advertise the Diversity Community Health Fair, the Alcohol Tax Prevention Grant application, our positions that we have open, the great work that our employees did in 2023, winter solstice, food safety, air quality program at the Solstice Tree Tour, and the Plug at 20 program. Currently, as of December, our current vacancy rate is 23.4%. So it increased a little bit from the past 3 months, which was at 21.8%. Our recruitment efforts remain the same. For the Anchorage Safety Center Patrol, overall, 319 individuals utilize services more than once, therefore creating 676 intakes or occurrences due to those multiple visits. The team responded to 1,212 calls and transported 524 individuals. So you will see a little bit of an uptick in that number from the previous month of even October and November. Which we believe is just due to the colder weathers and individuals, ingesting alcohol. Within our environmental health services team, they addressed 24 complaints. They performed 62 inspections, made 478 customer service contacts, responded to 12 foodborne illness reports. They completed 8 plan reviews and worked 24 plan reviews. They also issued 18 permits and 0 food worker cards. During the month of December, our air quality specialist was on leave for the month. However, with our environmental health educator, we distributed 117 Plug at 20 kits. So that is the block heater timer and an extension cord, along with literature about reducing air emissions. We had at that time about 28 remaining to be picked up by the public that had indicated that they would like to receive those. They worked on revising and updating the advertising for January and February with Alaska Public Media, iHeartRadio, and the Alaska Channel. We did some outreach planning meetings for the Winter Bike Fest in 2024, which is coming up here in February. And they started planning on the Bike Anchorage for Trail Tales, Big Fat Ride, Winter Bike to Work Day, and other events. They also completed the Solstice Tree Tour, the Nordic Ski Association, in December 17th. And an estimated 3,000 people attended this event, and they distributed 500 reflective lights during that event. So that's pretty exciting. They also created and posted social media content for air quality and food programs, bike safety, event promotion. They had ordered and received some bike helmets, designed some custom labels, and ordered Skidda hats for the Winter Bike Fest incentives. Within our, excuse me, Women, Infants, and Children program, our current participant level is 3,708 individuals. They did launch their new website, which has been quite a feat for that team.
No.
And
If there are members of the public on the phone, go ahead and make sure you're on mute. Thank you.
So what this website does, it allows applications to be created through Microsoft Forms. In the past, they were PDFs that an individual would have to complete and then submit. So it just allows ease of access for our participants, which is really exciting. And then it has more information regarding our services and referrals to a variety of community resources. Through the A-Tax Fund programs, they had produce incentives, transportation vouchers, nutrition education program, a paraprofessional nutritionist position comes out of those funds, as well as translation services. They had a total impact of 788 WIC households and provided over $30,000 to local growers and produce sellers during 2023. They participated in some outreach events, Preschool Family Night and Northwood Preschool, Mountain View and Muldoon Libraries, and Women's Care of Alaska. They're going to be piloting Doxy.me for video telehealth appointments this next upcoming quarter. Within our breastfeeding peer counselor program, we have one on staff, and that is providing breastfeeding support to 36 women that are currently enrolled. They had made 41 total contacts that were made in December to 36 enrollees. We had paused the referral program in August and November due to the staffing shortage, but we are ramping up in that program. The Anchorage Opioid Task Force did not meet in December. However, we did in January, so our next report will have some more information on that. But we did send a quick email to update the group and announce our meeting date in January. I wanted to take a moment and follow up on a topic that was brought up by Assembly Member Brawley last time in regards to the federal funding cuts for the WIC program. And so if I may, I just want to provide a brief statement to that. So the Anchorage Health Department has been monitoring the WIC program regarding federal funding and potential cuts. As we know, funding is in effect until March 8th of 2024, as the appropriation bill is still sitting with the House committee. According to the National WIC Association, for more than 50 years, the Special Supplemental Nutrition Program for Women, Infants, and Children, WIC, has been a cost-effective investment in the next generation, delivering healthy food and nutrition support to vulnerable moms, babies, and young children. With a proven record to improve maternal and child nutrition outcomes, WIC has long enjoyed strong bipartisan support in Congress. As a member of the WIC community, I urge you to support this crucial investment as fiscal year 2024 appropriation bills are finalized. Specifically, Congress should fully fund WIC to serve projected caseloads while protecting the program's science-based food package. WIC has experienced more than 15% increase in child participation since 2020, and the program is expected to serve as many as 7 million pregnant and postpartum women, infants, and young children in the fiscal year 2024. For decades, there has been a bipartisan commitment in Congress to provide necessary funding to serve all eligible participants. Should Congress fail to increase its investment in the WIC in federal year 24 to reflect growing caseload, state WIC agencies could be forced to turn eligible women and children away from the program for the first time since 1990s. Likewise, a cut in funding would endanger WIC's fruit and vegetable benefit, which has expanded in 2021 to provide families with access to a wider variety of produce and lead to a measurable increase in fruit and vegetable consumption among WIC-enrolled toddlers. Congress has maintained this modest evidence-based expansion of fruits and vegetable benefits in fiscal years 2022 and 2023, and should do so again in the fiscal year 2024. The evidence-based increase in WIC's fruit and vegetable benefit is also a core component of the USDA's proposed rule to update WIC's broader food packages and bring the benefit into alignment with the latest nutrition science. The proposal promotes balance and enhanced access to specific foods that deliver priority nutrients critical for growth and development at early life stages, building the foundation for healthier, lifelong eating habits. A decrease in federal funding could potentially have local impacts for families seeking WIC services from the Anchorage Health Department, including a decrease in client benefits. If there is a decrease in benefits, we would be forced to start prioritizing clients based on a criteria as outlined by the state of Alaska, which includes certain factors, and they have a list of those factors. So I just continue to urge your support in fully funding the WIC program for 2024.
Kim, is there any way you can send us that statement? And I'm just wondering if potentially maybe we could do a joint resolution for action with Health Policy Committee co-sponsors as well as the Health Department, and get, if that were to pass the larger assembly body, send that to our federal delegation.
Yes,
Okay,
that would
great.
be great. Excuse me.
Anna wants to ask a question.
Yeah, thank you. I think that's a great idea. And we do have an opportunity with our agenda deadlines to do that. So if you send that, then we can certainly make that into something. And thanks again for the follow-up. And it's unfortunate that federal political dysfunction is affecting people's lives. Thanks.
Within our community nursing program, we have reestablished tracking investigation of enteric disease in partnership with the state. We provided 44 COVID-19 vaccines and tracked 7 pathogen cases in December. The immunization side of the house provided 99 routine vaccines that were provided, everything from Moderna. We also did add to Assemblymember Brawley's comment made last time, we did add HPV into this section. So in the month of December, we did provide 7 HPV. We also did some high dose flu, regular dose flu, and some assorted others. Within our TB team, they provided and case managed 7 clients with active TB. They provided 38 IGRA tests and 1 skin test. Within our sexual health clinic side, 73 clients were seen in the STI self-referral walk-in clinic, which is ages 15 to 65 years old. Out of that, they performed 805 STI tests and had 25 of those tests come back positive. Within our substance initiative of the PHN grant, which is our public health nursing grant, they provided 24 naloxone opioid kits that were given out in December. 3 within our sexual health clinic, 18 by our front desk, and 3 at an outreach. And I also wanted to follow up on a comment made last time as into kind of looking at why we have seen a decrease in overall kits given out. So less kits have been attributed to the less demand. Kits are offered on demand at the above locations. And additionally, the sexual health clinic staff offer naloxone and fentanyl test strips during office visits. And then the kits are available at appropriate public events. And then we also post flyers in the exam rooms, and then we have it on our website. With our HIV prevention, we distributed 5,832 condoms throughout citywide. Within our teen unintended pregnancy prevention team, or it's actually just an individual. She provided 230 teens. She educated them on sexual health and relationships at 6 community organizations: Mears Middle School, Mirror Lake Middle School, and Wendler Middle School. And that is the update.
Okay, thank you. Any questions from members? I think we'll start with Member Brawley.
Yeah, thank you. First, thank you for the follow-ups and including additional information in the reports. I really appreciate it. Also wanted to give a shout out. Winter Bike to Work Day is on this Friday, February 9th. So thank you for promoting that. I am often lazy, but I will attempt to participate this Friday. And then I had 2 questions. First, on the safety center, and this might be a question more for the operators to come back for next month, but how much, because I understand there's a lot of repeats, how much month to month is it the same folks? Like essentially, are we seeing the same 300 people every month, or is it more of a rotating or kind of more diverse population?
That's a great question. And I haven't looked at and done a deep dive since probably around 7-8 months ago, where we looked at how many individuals were coming back. And of course, that data was scrubbed, but I couldn't tell you offhand if it's the same individuals coming. We just know that there are duplicates.
Okay, thank you. Yeah, that'd be something to maybe a few months from now look at if the operator's available. And then the other question was on the clinic. I know staffing was affecting the clinic's ability to be open. So I was just wondering, what are the typical hours right now of the clinic? Are there weekdays, especially that it's closed? Is it open on weekends? Kind of how much are people able to come in and get those services?
Yeah, excuse me. So we are open, they're open Monday through Friday. We did change recently as of February 1st, our administrative day. So that typically was Wednesday mornings. That is now Thursday mornings. The clinic is closed. But other than that, they are open Monday through Friday. And they open at 1 o'clock on Thursdays. And that is to align with our state partners because we have meetings with them to go over cases.
Sorry, and just one last thing I forgot to say. I had an opportunity to tour the Animal Control Center last month, so I encourage members to do that, and really appreciated. I guess it's contractors running it there, but really great opportunity to learn. Thank you.
Okay, great. Next in the queue, I have Member Rivera.
Thank you, Mr. Chair. Thank you for the update. A couple questions from me. First is on the Healthy and Equitable Communities Grant. I understand that the RFP for that closed in December. Do we know if the RFP decisions have been made and when that money is going to be going out? Do we have a deadline for when that money needs to be spent? And then do we have a total amount for that grant bucket? And then second questions on shelter licensing. Just wanted to see if the department had received any applications. Thanks.
All right. So to Assembly Member Rivera, I can answer the sheltering licensing component, and Tamaya can answer the Healthy and Equitable Communities Grant. We have not received any new shelter licenses.
And this is Tamaya on the Healthy and Equitable Communities Grants. We have finished all of our negotiations, and the recommendation for award assembly approval AM will be on the agenda at the next meeting. There's approximately $1.6 million in grants that will be going out to 10 organizations. And the current deadline to spend down those funds is May 31st, 2024. But we are expecting extension from our state partners. And once we have that, we'll pass it along to our grantees.
Great. Thank you for those updates.
Okay, any other questions from members? Let's go to Member Bronga, and then we'll go back to Member Brawley.
So this is a very elemental question, but I noticed the 12 foodborne illness that I think that's what you said. There were 12 foodborne illnesses. So maybe there's other people in the general population that, like, I would assume I had the flu, like if I got sick, but how does someone initiate? Like you go to the emergency room, how do you start this ball rolling if I think it came from a certain restaurant?
I think it can be a couple of ways. Some individuals do go see either a doctor or they go to the hospital. Other times they call us directly. They call our environmental health team and they make that complaint through that avenue as well. I think in regards to knowing the symptoms and things like that, we try to do a lot of social media posts surrounding what that looks like so that people are aware.
Okay, Member Brawley.
Yeah, thank you. The Healthy and Equitable Communities Grant reminded me, I did get feedback from one, I think, potential grantee that was frustrated with the short timeline and turnaround. I know that's been an ongoing issue. So just wanted to mention that. But also I know that's not really our role to get directly involved, but it just sounds like there's some continued frustration from grantees, not just for this, but other things on the process. So hopefully we can improve that. Thanks.
Okay. I'm not seeing anybody else in the room or by phone. So I think with that, we will move on to our next item on the agenda under new business, which is electronic grant applications and potential Title VII changes. So before we dive into this, I just want to provide a little bit of context. The three members in the room, myself, Member Braga, Member Brawley, are on the working group that is we are creating the strategic plan for the alcohol tax. And this is something that was sort of identified in one of the meetings that we have by the folks from the health department who are participating. Some of the ways that nonprofits are under current code having to apply for some of these grants. And perhaps they are cumbersome, not only for the applicants, but also for the department. And when we were discussing this in that meeting, I thought, oh, maybe there's something here. Maybe this could be the start of an interesting project for the assembly to take on and support the health department, support purchasing. Is there something we could do to maybe streamline or modernize this process? So I requested from the health department a memo sort of outlining what is in code now required, and I guess why is that a burden for you? And so they did provide that memo, and we have that here distributed in the room. It should also be on the website as well for those who are listening. So thank you to Maya for putting that together. And really what I'd like to do today is just have the opportunity to hear from the health department. Specifically, we were discussing some of the alcohol tax grants. And as Member Brawley just said, I think, we want to tackle how can we get those grants out timely. We also want to tackle casting a really wide net. So it's not just bigger established, community partners that maybe have the personnel to apply for some of these grants or know the process, but how can we reach out to those smaller groups or the newer groups who are doing important work in our community. And I think there's good alignment in the assembly wanting to do that, as well as purchasing in the health department. So this is start of a conversation and potential start of a project. Also, Assembly Council is exploring this issue too. So with that, I think what we'll do first is go to the health department and hear your explanation of kind of why you brought this forward and what your process is and how you think it could be better. And then I would love to hear from Rochelle Alger from the purchasing department. What is your perspective on current code and maybe how we could improve the process to be more electronic, if that's something that the purchasing department is interested in pursuing, pros, cons, etc. Okay, so we'll go to, I think, Tamaya first. Great.
Thank you very much. Tamaya Liebersbach, Anchorage Health Department. So I oversee our team that administers most of the grants and contracts out of the health department, everything other than HUD funds. So we are the ones who write the request for grant proposals, put them through the process, and then after the agreements are executed, administer those agreements. So, this came up during the alcohol tax conversation because specifically when the alcohol tax originally came out and we went through the request for grant proposal process, we received a lot of feedback, and I think assembly members did as well, that the process was very cumbersome for various nonprofits. And one of the specific pieces that has come up a number of times is the requirement to submit proposals, paper proposals, either through mail or in person. And so this is something that I will say we hear almost every time we do a grant process at the health department. Most nonprofits and organizations are used to submitting online applications. The state, the feds, most foundations have some sort of online application. And so this kind of, I think, takes them by surprise and does add some additional steps and requirements versus an electronic application. And so I think from our perspective, we are always trying to work to advocate for our community stakeholders. And for my team, a lot of those stakeholders are the nonprofit organizations that we partner with and work with. I think overall as well, the process is just more difficult for our nonprofit partners because they're not used to, checking a bid website all the time and pre-proposal conferences and things like that. Our process is very much how we do proposals and bids for contractors. And so we often need to provide them with some technical assistance to help them kind of work through a process that's very different than when they're applying for other grants. And so that's something that our team is always working on. And also looking at things like this, where possibly a change and working with another department and the assembly to make that change could really benefit our partners. One other piece is that during the COVID emergency, we were able to suspend certain rules. And so during that time, applications were taken electronically. And so when we then had to go back to paper applications, that was kind of a big jolt as well for the nonprofit community. And I think that, that feedback from them that, this worked much better for us when we kind of had the rules suspended is one of the reasons that we've brought this forward. So thank you.
Thank you. And so before we go to Ms. Alger, any questions for Ms. Liebersbach? Am I saying that correct? Liebersbach. Member Branca, and then we'll go to Member Brawley.
I just am not familiar with your grant process at all, but like challenge grants, they hold work sessions to show people how to fill out the forms and kind of hold their hand through it. Do you guys offer a process like that to help with? Yeah.
So it's a little complicated because essentially once we put the request for grant proposals out, there are specific ways that questions can be asked and answered by the grantees because we have to make sure that we're following the competitive process. So we also don't necessarily have a form that they're filling out. They are probably writing more of a narrative and then filling out certain forms. So there is a pre-proposal conference, which is essentially where the people who are interested can come and ask questions and we can answer those questions. And then they can also submit questions in writing that we can answer. But at this time, we don't have like that sort of technical assistance. And we did have that one time the assembly provided additional funds for technical assistance under the alcohol tax, and that was contracted out to a separate organization to provide that technical assistance so that we would not have a conflict of interest as the grant administrators, working with applicants.
Member Brawley?
Yeah, I think, so I've applied, I remember as being a contractor for the state, for example, and as you mentioned, proposals, professional services, it was at some point they did move fully over to allowing email. I guess my question is, because I'm seeing, you said physical documents need to be scanned in when you receive them. So can you just briefly walk through kind of the proposal review process, like how many people typically serve on a committee, and just to understand kind of the work involved with that?
Absolutely. So with the proposal review process, the number of committee members depends on how much funding you're giving out. So typically for us, we're going to have committees of 5 to 7 people. One thing that was common in the past, let's say when I first started about 6 years ago, was that we would ask partners to provide, let's say there's a 5-person committee, we would ask them to provide 5 paper copies of their full proposal plus 2 kind of formal copies that would be kept on record. And then we would hand out those paper copies to all of our committee members. They would, come down or we would meet them somewhere. So the first thing that as the health department, we decided to do to try and make the process easier on our partners is to just ask for 2 paper copies. So one that has an original signature and one that can be a copy, so that smaller nonprofits aren't trying to print off 7 to 9 proposal packets and, drop them off. So then what we do is we get those paper copies and we scan every proposal in so that we can electronically distribute it to our evaluation committee members. And that also is really their preference. Most of them don't want to come down to the health department and pick up a giant binder of proposals. They would rather have those proposals come to them electronically. So that's how we currently operate. We get the proposal, we look through it for certain eligibility requirements, make sure everything's there, and then we scan them in and then send them out to our evaluation committee members.
Thanks. And I know that was in the weeds, but I think it's just helpful to illustrate kind of the extra steps that we make people go through, both the applicants and then you guys, if you're literally scanning in something that was probably created on a computer, printed out, and then put back in. So I think that's, like there's so many things in our code where I think we can tighten up what we require without losing, requirement of keeping public records, because it also just saves staff time, which is super important. So thank you for bringing this.
Okay, great. And then I would love to hear from Ms. Alger. And I have some questions for you, but yeah, I want to hear your take on this. And I know your department is already looking at some of these issues and how we can streamline and modernize some things. So would love to hear what your thoughts are.
Okay, first off, I'm going to say, okay, buckle up. There was a lot of stuff that was just thrown out there. So first and foremost, I'm going to acknowledge that the basis for this is convenience. I mean, it's pretty evident when you get people, some of the nonprofits that have been around, United Way or Covenant House. These are very sophisticated nonprofits, and so they have the capabilities with computers, printers, jump drives, all that thing. So, but I agree that convenience is huge for our society right now. The challenges with this, and this is the part that's a little bit uncomfortable. The reason bids are sealed is because we need to keep them sealed so that somebody doesn't see them, then go to their favorite nonprofit and say, this nonprofit's got a better one than you need to resubmit your bid. And if we submit those via email, there's absolutely no way to keep those sealed. You could have somebody, we don't, on either side of the house. I don't think that's a problem with current staff, but you have to plan for the future as well as the current people that you have in your departments. The purchasing department could say, oh, I don't like that one. I got a sneak peek. Somebody in AHD could say, oh, I got a sneak peek, go and change. We do get bids that the contractors, it comes out on the website, they bid, and then all of a sudden there's an addendum and they come back and they grab their bid and then they give another one, and those are sealed so that you can keep that confidentiality. The state and whatnot, I went in and signed up as a person who wanted to bid, and straight out of the gate, they wanted me to pay $80. So I stopped at that point. I'm not going to pay $80 for a project or waste taxpayer money. I'll find somebody else who's already got that. So in order for me to even see what they have on their website for people to bid, I had to pay $80 to join this, to sign up for this program. So it is cost-based as well. When the purchasing department does want to go to electronic billing, or not billing, bidding, well, bidding too, or billing. Yeah. So, and the biggest reason we want to do it isn't for any one group. It's for the taxpayer group. We want to cast a wider net and get more bidders for every type of opportunity we have out there. So we do hear complaints of the same old nonprofits get it all the time because they're familiar, or the same old, plowers get it all the time because they figured out how to use it. So we're trying to cast a wider net and get more competition, better services, and better pricing and whatnot. With that, we have to take into consideration several things. One, we have to find the software that works. And with that, we can start off with kind of poking around and learning and investigating it. But then, as you know, we're going to have to either go to an RFP or an ITB once we get to that point. Whatever is selected has to make sure that it not only works with SAP right now, but as we move into HANA in 2025, we have to make sure that software will be accepted by IT for the new platform then as well. We also have to, purchasing, we're the wicked stepchildren. We have absolutely no budget. If our computers break, we have to hopefully move money around. We don't have money. So we have to plan for the funding and ask the assembly for that money for the service. And then we also have to forecast for the updates and the upgrades and everything that comes with it in the future. The other thing we have to consider as well is this is going to be a big change to our current bidders. If it's a platform that, like what I experienced with the state, we are going to have to charge these folks not only to see what the opportunities are, but perhaps to even submit them. So these are all things that have come up so far that we're investigating, and we're trying to find the gentlest way forward to accomplish the needs for not only for grant applications, but for all applications. And there are some tools that we can do now. So Tamaya mentioned that they hired a contractor for technical training. The purchasing department has spent the last year documenting all of our processes. They're on our Muniverse page, and one of them is grants, I believe, hopefully. Chris, Nikki, did we do grants? Okay, we'll have to. If we didn't, we will. And we're also in the process of creating more classes for municipal employees to learn how to have a better relationship with us. We'll do it for the grants. We'd be happy to invite the public in and help them walk through the process, teach them the documents. That way there's no conflict of interest, because we're not going to be on the evaluation team. We have no skin in the game. So we're happy to help with classes and helping them with that, especially for this year, because we're not going to get electronic bids this year. It's just not going to happen. During COVID, everything went to the wind, but I have several of my team members here that can tell you that it didn't work that well. There were lots of bids that didn't make it through. When there were changes, when you do an addendum to a bid, you have to allow for so many days for extend the bid so people can respond. Addendum or their responses weren't showing up. They were going to junk mail. So we had we had several disputes because bids weren't received. So it worked, but it didn't work. I mean, we made do for the situation at hand. As far as the copies go, typically, and I don't know if this is happening with the grants, usually when we send out a bid, we say bring in X amount of copies, but also bring an electronic version, so on a jump drive. So, we can ask for one paper copy and then a jump drive, and then and disseminate it that way. The part also with, if we were to just say, oh, let's go ahead and just do email this time. If the files are too big, they're not going to make it to us. So, we have to take this in chunks. And checking the website, we agree. It's cumbersome. It's there. We're developing a bidders list so that, and again, we don't have the sophisticated software to say, okay, this bidder wants snow plowing, this one wants jewelry, or this one wants shoes, to break it up within their business category. So what we will do now is when something happens, we'll send out a mass email. And if you're not interested in jewelry, then you just hit delete. If it's snow plowing and that's your game, then it'll come to your attention. We're also starting to send, this is kind of a little off topic, but just to show that we're trying to find better ways to communicate. We're also, and it's on my shoulders right now, so I'm a little delayed, but we're developing letters to send to bidders immediately that say, I'm sorry, you weren't the successful bidder. This is our next step. Please check the website for additional steps. You're not going to receive another letter. Otherwise, we'd be writing letters all day long. So that's my ramble. We have looked at what's happening. The Kenai Peninsula Borough does it. We have a member on our team that used to work there in purchasing, so he's doing a lot of communicating with his former colleagues. We're looking at what other cities do. We're not just within Alaska, but outside, and we're moving it as quickly as we possibly can. But it is definitely a priority for us. We even have a draft AO written for the second that we find the right product that we're ready to go and pull it forward. So we hear you, we understand, we want to help you. In the meantime, we're welcome to offer classes. We can advertise it as much as you want to, and we can get people in our conference room and walk them through all that.
Okay, thank you. So I have some questions, but first I'll see if there's questions from other members. Go ahead, Member Raleigh.
Yeah, I guess I understand the challenges with moving to electronic, but I'm surprised that the email, I guess I'm just thinking back to my experience working as a state contractor, so I've responded to a lot of proposals. I remember we would submit them by email. There was a secure email that you would send it to. So it didn't go to an individual, it would go to an inbox. So I imagine there's ways to basically limit access to that inbox. So I understand the value of having it sealed. And then I'm surprised also that you had to pay to sign up for the state of Alaska's vendor system, because I remember having an account, and it's possible that our company paid for that. But I know there's third-party sites where you can sign up and get those, because they'll aggregate a bunch of different ones, but I believe the state system is free. So, and again, it's something that they've been doing since I want to say 2015 or so is when we stopped having to print out pieces of paper to send to them. So I guess I would just encourage looking at that. Also, I know, for example, the state just updated their alcohol licensing system. They had a marijuana licensing system, and it did take an additional one-time appropriation to do that, but they were really able to save a ton of staff time, because that was one of the big challenges, is the paperwork and everything made them not able to respond to questions or not being able to give customer service really to applicants. So it just seems like I appreciate the barriers that there are, but I think they are surmountable. So I appreciate that you guys are looking into it. Thanks.
And then I have Dean Gates in the queue.
Yeah, I want to make sure you can hear me okay.
Yep, we can hear you.
Yeah, okay. I'm watching the meeting online, but it's like a couple minutes behind, so I'm a little uncertain if I'm speaking up at the right point. But anyways, I just wanted to speak to the electronic submission of bids or proposals or applications. And I did get asked about a code change to enable it. And to be quite honest, the code change to at least authorize or require even electronic submission is a very easy step to do. I think that the more difficult and detailed part will be the department purchasing or then how their processes actually implementing the processes and procedures that they've been discussing for. So I just wanted to mention though that it's absolutely easy to do, at least as an authorizing code amendment. We do have state statutes called the Uniform Electronic Transactions Act that has some sections about acceptance and distribution of electronic records by government agencies. So, we just need to get into the 21st century here.
Thank you, Dean. I think that's a great point. So that kind of, I guess I'll go ahead because I don't see anybody else in the queue. I think my perspective on this is right now, perhaps code is overly prescriptive and is setting too firm a boundaries around the process. And so could we move forward? I guess a question that I have is, could we move forward with an AO that would amend Title VII to at least allow for an electronic submission process? Because I think there's two different things. I think that there's the code amendment that could create the potential to do that. And then there's going to be the implementation, which, as Ms. Alger has laid out for us this morning, is going to be more challenging and require a series of steps and looking at vendors, et cetera. So I can certainly appreciate the challenge that might be, or not even a challenge, but I guess a task. But I think the first step that we could take is saying, okay, well, this is something that could be envisioned by code. So I appreciate that feedback from Dean. A few more questions I have. So, okay, what code changes are needed to move the system for vendors responding to purchasing contract solicitations to a digital system? I think Dean's working on that, and sounds like maybe Ms. Alger, your team has a draft AO. If you want to share that with, okay, if you can keep it for now, great. And then, but yeah, I mean, really, I guess my intent in this project is I want there to be open lines of communication, just so nobody's toes are stepped on and there's no unforeseen consequences. And then I guess so in terms of like how the applications would be submitted. I'm doing my taxes right now, which is very fun. And my CPA has like a secure portal that I use. It's like a client tax organizer. And then that's how I drop all of my documents in there, right? And it's password protected. So I'm not just sending him stuff via email. That would not be as secure, right? So certainly that is what I'm envisioning, is some type of, secure, maybe two-party authenticated, whatever portal that people could put their documents in to. And so I think that would be interesting to contemplate. And it sounds like maybe your team is already researching that a little bit. And then one question that I had, and this is maybe just, my own lack of knowledge, but so the alcohol tax grant mechanism, because with the memo that we have from the health department, Anchorage Municipal Code 7.20.20 and 60, it's sort of, I guess the thing that those are the sections of code that were identified by the health department as being a challenge. But then there's 770, the regulations pertaining to grant proposals to nonprofits. So I guess how do those play together? And because I guess I just don't see in that section of code the requirement to do the sales bids with the 5 copies in the thumb drive and all that. Is there a separate process for those type of grants, or are the two related or subsidiary to each other in some regard?
So in addition to the code section in Title VII that you referred to related to grants, there's actually a policy section that is like the Title VII policy about grants that says that whenever possible, we should put it out to competition. And so then when we're putting it out to competition, then that's when we go up to the competitive code around how proposals work. You're right that it doesn't say you have to have X number of copies or anything like that. And so that's why we've reduced the number of copies that we require. One thing that's a little bit difficult with the USB is that, as you may know, we have an IT policy that says we can't put any foreign USBs into our computers unless they first analyze them for viruses. So that, just from the health department's perspective, is why we take the route of scanning all the documents in, because it's really hard to get IT time for them to analyze all of those, especially if you have, 20 proposals.
Good. Actually, I think that answers my questions. I guess is there anything in that section of code that would need to be clarified or updated to streamline alcohol tax grants? Or, I mean, can we break those things apart? And I actually think this is a good question for you, Ms. Alger, how those two things play together, those two sections of code, if you feel comfortable.
Yeah, sure.
You could also
So
email us or whatever.
No problem. I can't give you specifics, but one thing I can tell you that purchasing runs into quite frequently, and it's just human nature. People find a section of code that fits their need and zeroes in on that and says they see the tree. They don't see the forest. So when you find that part of code, there is inevitably a branch over to the left and a branch over to the right, and there's more of a forest, and it all pulls together for one understanding. So before I comment on these things, I like to go through with my little ruler and connect all the dots before I give an educated decision on that. And I'm sorry you've had a delayed experience with IT, with jump drives, they turn them around for us sometimes same day, but no longer than 24 hours. So that, and in addition, charter, which as you know, it goes charter, code, PNP, charter specifically says we will use the competitive process for goods and services. And that applies to grants. It applies to how we're spending money all the time. So whenever we can do competitive process by charter, we're supposed to do that. And I don't ask me where that, what part is. I can send it to you later, but it's there.
I would appreciate that because I
I
know that,
will.
the assembly can do direct appropriations to a group without going through a competitive process. I mean, we've done that before, direct grants.
You have, but
Uh-huh.
again, charter kind of, it governs all of us. So that's, we in purchasing try and follow the charter, the code, then the PMP, and then of course present to the assembly. So we have to come to you for permission. So there are different parts that give you guys different
Right.
privileges than what we have, because there's
Okay.
12 of you to make the decision and
Yeah.
only one of us.
Yeah. Okay. So I think that would be really helpful is from your lens, maybe a memo to the health policy committee, or you can submit it to Karen and I, and we can distribute it. Yeah, just I guess how those, I will follow up with email questions for you, how those sections of code and essentially how you envision those parameters would be helpful. And just, how can we unpack them or not? Should we leave them as is?
All right. And then,
Yeah.
I'm sorry, go ahead, Anna.
Member Brawley.
Yeah, just I did look up the charter section. So it's section 1309. It says competitive bidding. It says the assembly by ordinance shall provide for competitive bidding for goods and services and shall make provision for any exceptions. So I think that's something we can dig into later, but also just to note, I would see a material difference between a grant that may or may not be providing a municipal service versus contracting for municipal goods and services or purchasing materials or things like that. So I think that's a question to dig into later, I think. But I read this language as being a little bit more, I guess, less prescriptive. Thanks.
And Member Brawley, that is something that we've taken a look at. We had a circumstance come up back in August, and that is, we've been going through many different things with Title VII and the way Title VII has been applied, that we've discovered Title VII has not been accurately applied, and grants is also on our list. And we have a lot of documentation past AOs and AMs and whatnot, and that we're compiling to address with legal. So it's not something that we take lightly, and it's not something that we can do in a matter of a day or two. And our workload, and I know you hear this from everybody, is through the roof. We're coming up on construction season. We're already starting to see our workload tick up. And so my ask for myself and my team is, if we could get through this alcohol tax season without making significant changes, we will help with training and let us get through analyzing the electronic aspect and bring it back and discuss that with you guys and participate in the process. If we make any sudden changes right now, quite frankly, my department will be buried and we won't survive. We kind of need to just carry on status quo. Last year, we had a record year. My department produced more ITBs, more RFPs, more of everything than any year before. For example, last year, we did 67 RFPs. The highest ever done before was 40. So we need to, and we're anticipating a lot of work from the port, from AWU, from M&O. So we will help you guys as much as we can. We will, I will put in the extra hours, but if we can just do our best not to do this year and
Well, I
give me a
think
little
there's a
time.
couple of things that we can look at. Number one would be like, whatever the ordinance is that comes forward, an implementation date that's realistic for your department. Also, again, I think right now they're like one process that's outlined in code, and essentially, I think what I would be interested in doing is allowing for another process, not an ordinance saying it must be electronic submission and electronic submission only. Maybe we could focus the options, and maybe there's a phasing in period, right, where you're accepting both paper applications, but in code, there could be an allowed for electronic process. Not that it has to be implemented tomorrow. So I think because Assembly Council, I know, was working on exploring those code changes. And Dean, if you're still listening, if within that drafting process, I think from my perspective, that would really be the goal, is to, not essentially put us in a situation where we have to implement this tomorrow and it's like the way and it's a burden to your department and other departments, but what is a path forward for allowing that type of process? And so I think my final question for you, Ms. Alger, would be what do you want the next steps to be in this process as we move forward with this? And what would be like a reasonable timeline?
Thank you for asking that. So the next step, quite frankly, would be for us to explore quicker and faster. And I will apply that pressure, and I will assist with that too. And from there, I would like, how often does your committee meet? Monthly. Okay. So at the next committee meeting, I'd like to be on the agenda and be able to come and follow up and let you know where we've gotten to. And I'm happy to send emails along the way, so it's not just an information dump when we get here. And hopefully come to the table and say, we can do this, we can do that, give you some options at the next one. Maybe we can figure out an email, a private email type thing. We've explored that too. And I don't have the pros and cons with me, but we've had too many cons. Otherwise we would have done it already, because we're chomping at the bit for this too. So us to investigate more, come back with some substantial things that we've accomplished at your next meeting. And then hopefully by the second meeting, be ready to either do an ITB or an RFP, or maybe we already have, and start writing the changes and put the costs and everything before the assembly. And I'll go shake down Alden and see where I can find some money.
Okay, no, I think that would be very helpful. Great. So I think what we should plan on then, my co-chair, Member Braga, because I know we were looking potentially at March doing kind of an interesting committee meeting where we were going to tour the health department. One other option we could do, and maybe our legislative services team could help us with this, because I think this really is a worthwhile project of keeping on top of. So we could keep you under our unfinished business for our March agenda, and then we could either do as a committee meeting, our next committee meeting at the health department, because I was just kind of imagining a walk and talk tour where we meet some folks and we see the facility. We could do that potentially, if we can find the time, as a separate work session, like we've done work sessions in the past. When we toured the lake house, or we've kind of done that, and Claire brings her phone or somebody else, so members can watch it later on YouTube. So let's be in contact about that, see what we want to do, because I do think Member Braga and I really want to get our colleagues over to the health department and take a look. So, okay, we'll be in contact about all of that. And I really appreciate the participation here today. Thank you for this conversation.
Thanks, everyone.
Yeah, great. I think we're good. Any other questions from members on the phone? I'm not hearing any. Cool. Yep, go ahead. Thank you. With that, we don't have anything else on the agenda. I know, Member Braga, did we have someone who was going to potentially be calling in?
Yes, Maddie from Eagle River High School was going to call in at 10:30 on her lunch break to tell us about what they're doing with teen dating violence education. And unfortunately, she's a student. She said she's got to do it at lunchtime. So I asked her to try to make it a little bit early. And if she happens to be, no, she's not. What do you think?
We
What
don't
should
think
we do?
Maggie's on the phone. Well, I don't know if I can vamp for 15 more minutes,
Do a little
but
riffing?
yeah, but I would love to hear we love to hear from students who are engaged in their community. So I think, yeah, you want to do that?
Yeah.
Okay,
We don't have to end the meeting.
yeah. Member Brawley is suggesting that we just take a break. We'll take an at ease, a recess for 15 minutes, and then come back at 10:30. Okay, great. Okay, I'm going to bring us back. It's 10:27. Believe that we maybe have our student caller on the line, but I will turn it over to Ms. Bronga.
So I'm just checking. We see that a new person is online. Is that you, Maddie?
She's joining right now.
Okay, great. So for those of you who are wondering what was going on, we took a brief break while we were waiting for Maddie from Eagle River High to join us. She represents Alaska Teens Against Abuse, and they're doing a campaign about dating violence, and we're going to give her a minute to talk about that. As soon as she gets all logged in, you can just pop in and start talking.
Maddie, are you on the line with us still?
I think she's just trying to join because it's her lunch break at high school.
Okay. Ma'am, can you identify yourself for us?
Yeah, this is Garen Tarr. I'm working with Alaska Network on Domestic
Oh.
Violence and Sexual Assault.
Hey, Garen, great. And then, Mandy, does Maddie maybe need to press something to unmute? Oh, okay. Okay. Okay, then I guess we will still be on standby.
One other thing I wanted to add is Ms. Honest is going to email around the website that is for Alaska Teens Against Abuse, and I also sent that to you, Director Rash. And I did see that Maddie has a little video clip of herself announcing an event on that link I'm sending you, but we'll cross our fingers. She's coming in soon.
Why don't we do this in the meantime?
Hello.
Oh, go ahead. Is that Maddie?
Hi, yes, this is. Hello.
Hi, Maddie. You are on with the Anchorage Assembly Health Policy Committee. And Member Bronga let us know that she had invited you to participate today. And we gave you a little introduction. So I think without further ado, we will go ahead and let you take it away and tell us about what you're working on.
Hi, thank you so much. Yeah, so I'm Madison Ariola, and like you heard, I am working with Alaska Teens Against Abuse. And our main project that we've been working on is essentially to help prevent as much violence as we can with people around Alaska, especially teens. We have been working on our project according to the February Teen Dating Violence Awareness Month. So February right now, we are trying to make the most awareness we can about relationships for teenagers and about consent. So in a little video we have sent out AlaskaTeensAgainstAbuse.org. We have been working on making videos. I have one there right now, and essentially our goal is to spread awareness about healthy relationships and consent, and we're trying to make this an open conversation for teenagers to have around Alaska, and we're really trying to educate on the consent bill that we have in Alaska about what is sexual assault, what is domestic violence, and how can we prevent it the most in teenagers around Alaska. So this is a really nice project. We have been working on it for about like a month now, and it is with a few students around the ASAG, Alaska Associations of Student Governments, and we are really proud to have this work. And our main goal is to make teenagers as open as they can be with each other on issues such as domestic violence, healthy relationships, and having consent. And we hope to make an impact on that, and that teenagers will come together to make more videos for us to help our organization stand out, and hope that we can make the message that there are Alaska teens around Alaska against abuse. But yeah, thank you.
Wonderful. Can you say the name of the website one more time?
Yes, it should be AlaskaTeensAgainstAbuse.org.
Fantastic. Any members have questions for Maddie? Member Bronca, go ahead.
So Maddie, do you have regular meetings at Eagle River High, and what other high schools are involved in the project?
So right now at Eagle River High School, we don't have meetings yet, but we are in the works of putting up flyers for students to be aware about our organization. And we also have, I believe, students from, I think, Sitka. We also have another student involved with this from Sitka as well. I know we also have another member. We have Jasmine, who's from Sitka, I believe, and we also have another student named Cora. I will have to check again which school she is from, but we are across Alaska very far, so it is multiple schools. But we have not yet to have like actual meetings yet about it. But we do have flyers going around.
Very good, thanks. And I thank you for taking time from your lunch break to come in and talk to us about what you're working on. And we have shared this website, and yeah, keep active in politics. This is what we need.
Yeah, thank you, Maddie. Thank you for participating today. You bet. On your lunch break, no less.
Of course. Yep. Thank you.
All righty. And with that, I think we will go to audience participation. Are there any members in the audience who wish to provide comment this morning?
Yeah, this is Thea Agnew-Benben. I would like to.
Oh, sure. Go ahead, Thea. I'm setting your timer for 3 minutes.
Great, thank you. I wanted to go back to, it's really a question. I wanted to go back to the discussion about purchasing and how to make the grant process more accessible. I looked on the Muni webpage at the competitive process, which I think was what Ms. Alger was referring to, saying that all grant processes needed to follow that process, which makes sense to me. I think there are times when maybe, like, as you said, that isn't appropriate, but a lot of times it is. But I guess I'm just not seeing on here where it's very general, actually, what's posted here. So I guess my first question was, is there more detail somewhere that is leading to the current process that requires the paper copies and I was also a little bit confused by the discussion around the jump drive, because if we are afraid of getting viruses through jump drives, why would we want people to use them? And it does seem like, as Anna was saying, that a secure email would be less risky for the Muni than having people use jump drives. So I guess I'm trying to, I also want to make a comment that, I'm a business owner, who has decades of experience responding to bids, because that's what I do. That's our business. That's a really different mindset and kind of business model than most nonprofits. So I think, I totally understand we need to follow our purchasing requirements, but it does seem to me that the health department could design within the parameters of the competitive process a much more accessible and proactive way of communicating and allowing nonprofits to submit grant proposals, and that could be done through a secure portal, as the state does, or as many foundations do. And it could still comply with our purchasing requirements, but perhaps the lead on that could be the health department. And I know that we're discussing this as part of the alcohol tax strategic plan, but I just want to say that the earlier discussion about the Healthy and Equitable Communities grant just illustrates that this type of process is needed for all the grant opportunities that the health department issues, and that really it needs to be done through a different model, because the audience is really different. Nonprofits work really differently than businesses. So I'm sharing out there, hoping that you could respond to some of those questions.
Sorry. So your 3 minutes is up now. Definitely appreciate that. Typically during the audience participation, we don't respond to questions, but let me just see, is there anybody else in the room or on the phone who wants to provide comment? Any members of the public? I'm not seeing any. So in that case, is there anything that the health department wants to respond to there from Thea's comment?
This is Tamaya Liebersbach from the Health Department. Thea, I'm not sure where you're looking. I don't know that the full competitive process is outlined on the purchasing website, but the requirements for paper copies or paper submissions are outlined in code under 720.020D and 720.060C. And then there's also a regulation 7.70 specifically related to grants and grant proposals. And it also talks about submitting physical copies.
So yeah, I definitely think there's more to unpack with this conversation. I'm glad we're going to keep it moving ahead, and certainly for my part, would love to see a more streamlined, modernized process and user-friendly process for our nonprofit applicants for grants. Okay, with that, we don't have anything else on our agenda. I think we will go ahead and adjourn. Thank you, everyone.